Well, over the last 5 or 6 years, we've been campaigning in the UK for gender-neutral vaccination. In other words, the vaccination of both girls and boys at the age of 12 or 13. The UK has had a vaccination programme for girls since 2008. It's been a very successful programme with over 80% of girls vaccinated. But boys have been excluded from that. And we didn't think that was fair, and it wasn't in the best interests of public health, the health of girls or boys. So we've been campaigning ultimately successfully for boys to be included in the programme. And I'm absolutely delighted to say that from this September, boys are now being vaccinated in the UK. So we have seen an essentially doubling of the vaccination programme, and that's great news for the health of the whole population. Well, we know that HPV causes a wide range of cancers. Obviously, the best known is cervical cancer, but it also causes some cancers of the head and neck, penile cancer, anal cancer, and some other gynecological cancers in women. So it is a huge problem. It causes 5% of all cancers. So it's vital that we actually tackle the HPV epidemic, bring rates down, and protect the population. Now, because we're talking about cancer, it takes many years for cancer to develop. So it's unrealistic to expect us to see a huge impact in cancer rates quickly. But the other thing to bear in mind is that HPV also causes genital warts, and they develop much faster than cancer. So the immediate benefit we've seen from vaccination is a dramatic fall in genital warts infections. So we know the vaccine works because it is impacting on genital warts. But it has also had a big impact on pre-cancers, pre-cervical cancers in women. And a recent paper that came out in Scotland showed that there was a 90% reduction in pre-cancers in women in Scotland. And we know that's going to, in time, be followed through in reductions in oral cancers, anal cancers, and all the other cancers that are caused by HPV. So we expect over time the impact to be very dramatic. It's absolutely critical to how we tackle HPV infection, and if we vaccinate both sexes, we can actually eliminate most HPV-caused cancers. Now, what makes vaccinating boys as well as girls so important is that for some men, men generally get some kind of protection from vaccinating women, because obviously men can't acquire the HPV virus from a woman who's been vaccinated. But many women aren't vaccinated. There are some countries where vaccination rates of women are relatively low. In the UK, we're lucky, it's a 80+% vaccination rate. Other countries have much lower rates of vaccination in girls. So vaccinating the boys there will have an obvious impact, and it will also protect girls, because obviously those girls who haven't been vaccinated can't pick up HPV from a vaccinated boy. But even in countries where there are high vaccination rates in girls, those boys still need protection, because men have sex with men, for example, and men who have sex with men are completely unprotected by a girls' programme. So that population has to be protected by a vaccination programme for boys. Also, even in countries which have very high vaccination rates, say 80%, that means that 1 in 5 women aren't protected, so boys could acquire HPV from one of those unvaccinated women. And of course, men travel. They go on holiday, they go on business, they have sex with women from other countries who may not have been vaccinated. So a vaccination programme for both sexes protects both sexes against the HPV-related diseases. Well, it would do exactly what I've just said, really. It would protect both sexes against the risk of HPV infection, and over time we would see not only a huge reduction in genital warts, which is unpleasant, won't kill you, but it's an unpleasant condition, but we'd see a long-term fall in cancers that are caused by HPV in both sexes. If we could actually have HPV vaccination worldwide with perhaps 80+% vaccination rates, the impact of that would be enormous, and we could see an almost total eradication of HPV-caused cancers. Well, there are a number of obstacles. Money is a key one, particularly in low-income countries. We know that's a particular problem. In Europe, I think there are different problems. Money is still a key one, and I think governments need to be persuaded that in the long term, investment in HPV vaccination will actually save money because of the cost of treating all the conditions that are caused by HPV. The costs are huge compared to the cost of vaccination. So that's one issue. We also have another problem is the fake news around vaccination. So there are unfortunately a large number of people parents who think that they're putting their child at risk of harm by HPV vaccination. The science doesn't support that at all. HPV vaccination is incredibly safe, but we need to do more to try and convince those people that vaccination is safe and give them the reassurance that they need. And the other barrier is delivery systems, because even though some countries which have vaccination for boys or boys and girls, the delivery system is not particularly good. And we know that generally speaking, the best systems are where vaccination is delivered in school. Where you have a school-based system, you're more likely to have high vaccination uptake, and that's what we should be moving towards.